This video will pick up from where the first video left off. In this video, concepts related to infectious disease are presented. Consider this as you read from the textbook and watch the video. You are aware of the presence of infectious disease in the hospital setting. In this acute care setting, the hospital environment is controlled using isolation precautions, separation of infected patients by physical hospital walls. Treatment is provided using lab work and discerning which anti-infectives will work against the organism, and each patient is given their treatment and medications as prescribed. In other words, infectious diseases seen in the hospital setting are controlled and monitored. Now imagine an infectious disease without all these controls. Individuals who are infected mingle with everyday community members at shopping centers, sports events, restaurants, etc. Even more concerning are the myriad of ways in which individuals can be infected, such as through improper hand washing or food handling, unsanitary conditions, and vector-borne illnesses that are carried by insects like mosquitoes. This is why understanding how infectious diseases are transmitted is important, because communities are most vulnerable to the spread of infectious disease after a community disaster. Even without a disaster occurring, nurses in everyday practice need to understand the principles of infectious disease and why these diseases must be identified and treated for the safety of community health. Even though we have improved sanitation, developed vaccines, and antibiotic therapy, preventing and managing infectious diseases continues to be a challenge. As a nurse working in the hospital, you are aware of drug-resistant organisms and diseases related to this antibiotic resistance, such as methicillin-resistant Staphylococcus aureus and C. difficile gastroenteritis. Other concerns are related to the emergence of new pathogens and new infectious diseases. The CDC now publishes a journal, Emerging Infectious Diseases, which is available to everyone at the website listed in the textbook. Terrorists are also using deadly pathogens as weapons. Therefore, nurses are required to know about recognizing, preventing, and controlling infectious diseases. There are 4 basic principles of infection and infectious disease occurrence. The first principle is multi-causation. Think back to the epidemiological triangle. Infectious diseases are the result of interaction among the human host, an infectious agent, and the environment that impacts the human host. This principle of multi-causation emphasizes that an infectious agent alone is not sufficient to cause disease, as the host must be susceptible and the environment must be ideal for the infectious agent to exist. When an agent does infect a human host, 3 levels of infection occur. This is called the spectrum of infection. The first level is colonization. This occurs when the agent is present on the surface of the body or in the nasopharynx and multiplies its numbers without producing any identifiable evidence of a reaction in the person. Typhoid Mary is an excellent example of colonization. Typhoid Mary carried the typhoid virus around with her and spread it to others, but did not show any of the typhoid symptoms herself. The next level of infection is a subclinical infection, and this occurs when the agent is not only present but multiplies in the human reservoir. In this type of infection, the agent causes a measurable reaction but doesn't cause the human host to have any symptoms of the illness. An example of an inapparent infection is HIV. An individual can contract the HIV agent and be asymptomatic, but after lab testing, the HIV agent is detected by the antibodies the body produces to fight it off. The last level of infection is a clinically overt disease. This is where anyone, including healthcare professionals, can detect the disease in the individual because the physical symptoms are present. Continuing with the HIV example, Kaposi sarcoma skin lesions on an infected individual identify him as an HIV-infected person who is showing so overt symptoms of the disease. Once the infectious agents replicate in sufficient numbers, they can be transmitted from the host, irrespective of whether disease symptoms are or are not present. There are stages of infection as well. The time interval between initial contact with the infectious agent and the first appearance of the disease symptoms is called the incubation period. We all come into contact with many infectious agents on a daily basis. Think back to the last time you had a cold or the flu. Most likely, your immune system was able to overcome the infectious invasion to a degree, and you did not develop a full-blown case. You encountered the infectious agent by either coming into contact with a person or an inanimate object. By the way, door handles are notorious reservoirs for infectious organisms. Once the agent colonized on your skin or nasal passages, it began to multiply. After a few days, you may have begun to feel poorly. The period between the time you contracted the agent was the period of inapparent infection. Once you began to show symptoms associated with the agent, in the case of a cold, this would be your runny nose, your fever, or cough, you showed a clinically overt disease. Your friends and family probably stayed far away from you in order to avoid getting sick themselves. When you began to show signs of being sick, this ended the incubation period. During the period of infectivity, the infectious agent can be transmitted directly or indirectly from an infected person to another person. You should really cover that cough or sneeze. This is why Centera, as an organization, requires the wearing of a mask during influenza season if the flu vaccine is refused. Spreading the influenza virus from infected employees during an inapparent infection could cause devastation in a hospital full of immunocompromised patients. There are different terms to describe the spectrum of disease occurrence. Think back to epidemiology once more. Remember the terms incidence and prevalence. When looking at populations, control of infectious diseases requires identifying and monitoring the occurrence of new cases of the disease in the population, or the incidence rate. If the disease is kept mostly within a geographical area, the disease is endemic and occurs at a consistent, expected level in that geographic area. Some examples of an endemic disease are sexually transmitted diseases and tuberculosis. An outbreak refers to an unexpected occurrence of an infectious disease in a limited geographical area during a limited period of time. Examples of an outbreak include pertussis, or whooping cough, and salmonellosis. I can't say that word. An epidemic refers to an unexpected increase of an infectious disease in a geographical area over an extended period of time. And finally, a pandemic is the steady occurrence of a disease over a large geographical area or worldwide, such as the malaria infection in Africa. The chain of transmission is defined as the minimum requirements for a communicable disease to occur. There are 5 factors that make up the chain of infection, and it will be important to understand each of these factors in order to determine at which stage a community health nurse can intervene. The first factor is the infectious agent. This is the pathogen, such as a viral agent, that causes the disease. These agents differ in their ability to cause serious illness or even death. The seriousness of the agent is how likely the organism is able to cause disease. The pathogenicity is the agent's ability to cause disease to their infected host. Virulence is along the same concept as pathogenicity, but refers to the ability of the agent to produce serious illness. For example, influenza has a great capability of causing the disease to occur in an affected host, so it has increased pathogenicity. But influenza also has great virulence because a host infected with influenza can have a serious illness. Check this graph out. This is taken from the CDC and is compiled from data relating to the number of influenza-associated pediatric deaths in the United States from 2011 to 2015. From 2011 to 2012, note that the number of total deaths in this population was 37. Now look at the deaths from the 2014 to 2015 period. The deaths associated with disease increased almost 400%. What happened between 2011 and 2015? The deaths associated with this disease should not have occurred because don't we have vaccinations for influenza? Don't we regularly advertise and encourage pediatric patients to receive this vaccination? This graph illustrates why communicable diseases and community nurses are forever connected. This graph demonstrates that we are apparently not doing enough to protect this population's health when it comes to influenza. The reservoir is the habitat or the medium in which the infectious agent lives and/or multiplies. Mary Mallon, also known as Typhoid Mary, was the reservoir for the typhoid virus that lived in her. Reservoirs can also be inanimate objects, and this is why hospital surfaces get wiped down so thoroughly when a patient is on contact isolation. Portals of exit or entry are the highways in which infectious agents travel. Portals of entry include respiratory secretions, vaginal secretions, semen, saliva, exudate, blood, and feces. Portals of entry are frequently the same as portals of exit and include respiratory passages, mucous membranes, open wounds, ingestion, and through the placenta or skin. How infectious agents are transmitted plays an important role in the context of community nursing. Knowing how diseases are transmitted and spread allows for an understanding of how to control their spread and prevent them from occurring. There are three modes of transmission of any infectious agent: direct, indirect, and airborne. As seen in the previous slide, and currently as you work in the clinical practice setting, hand washing can't be stressed enough. You should wash your hands as often as possible, both in and out of the clinical setting. Currently, if you are not working with any airborne infectious agents such as TB, you should be wearing a particle mask that has been fitted that would protect you from this disease should a clinical patient have it. But think about what community individuals do who have this disease. What do patients who are having active TB do while they are in the community setting? Think about that as you enjoy your next concert or sports game. Direct transmission is the transfer of an infectious agent from one infected host or reservoir to a portal of entry in the new host. This could be through biting, like a Zika virus being transmitted through a mosquito bite, kissing, or direct projection of droplet spray into the mucous membranes of the eyes, nose, or mouth. Host susceptibility refers to the host's ability to resist disease. If the host has a healthy functioning immune system, resistance can be successful. Other factors also play a role in the host's susceptibility, as presented here in this diagram. Biologic, personal characteristics play an important role in host resistance. Personal behaviors, such as practicing safe sex, influence susceptibility, as does the presence of a healthy immune system. Indirect transmission occurs through either a vector or vehicle. A vector is a form of a living organism, like a flea, while a vehicle is an inanimate object, like a door handle. Mechanical-borne vector-borne transmissions occur when the living organism lands on a body of water that hosts the agent, and then the agent is carried by the living organism, but the agent doesn't multiply in the organism. Fomites and food are examples of vehicle-borne transmissions. Fomites are contaminated inanimate objects like toys, soiled bedding, and clothes, as well as surgical instruments that have not been sterilized. Do you remember those popular ball pits that were found in children's indoor playgrounds? Guess what? These are mechanical vectors for diseases. Here is a study that was done in 1999 by registered nurses at Riverside Regional Medical Center in Newport News that suggested that non-human bacteria are present in these pits, which raised the question about the safety of these play pits. Now, how many ball pits do you see in children's play areas? This is a great example of how nurses can intervene in the transmission of infectious diseases. Biological vector-borne transmissions occurs when an agent multiplies in a living organism, and now that organism transmits the agent to a new host through a bite. Fleas are examples of biological vector-borne transmission modes, as fleas carry the bubonic plague virus. Did you think that plague had disappeared from our population? It hasn't, and this news article, dated as recently as June 2016, should indicate to you that these communicable diseases are still being carried by biological vectors. Can we eradicate every flea in the world? Of course not, and that is why community health and community nurses are so vital for population health. They recognize that these modes of transmission are still available and make plans to intervene and prevent the spread of diseases. Airborne transmissions occur through droplet nuclei and dust, which are particles suspended in the air in which microorganisms may be present. Coughing, talking, or sneezing can spread these microorganisms through the air and can remain suspended for a long time. This is why the hospital uses negative pressure rooms for those infected with airborne diseases like tuberculosis. How infectious agents are transmitted plays an important role in the context of community nursing. These modes of transmission will help us to prevent the spread and transmission of the disease. And doing that is called breaking the chain of transmission. Breaking just one of these chains in the links in the chain of transmission is what's done to control transmission of the infected agent. Inactivation of the agent is the principle behind disinfection, sterilization, and radiation of fomites that may harbor pathogens. Anti-infective drugs such as antibiotics, antivirals, antiretrovirals, and antimalarials all play an important role in controlling diseases. Eradicating the non-human reservoirs means eliminating sources that could allow the pathogen to live and multiply. Reservoirs include water, food, milk, animals, insects, and sewage. Local examples of this type of prevention and breaking the chain at this link include community spraying for mosquitoes and eliminating standing water where mosquitoes can breed. Nurses and other health care providers break the chain of transmission at the portal of exit by disposing of secretions, excretions, and exudates from infected persons. Controlling of exit and entry also includes isolation of sick individuals wearing from others and requiring individuals who are infected with TB or flu to wear a mask while they are in public. The portal of entry is controlled by using personal protective equipment, including masks, gloves, and condoms, and avoiding unnecessary procedures like inserting indwelling catheters, and protecting from vectors such as mosquitoes. The basic assumption in dealing with any individual should be that all people are infectious, and healthcare workers should treat them as such. Another way to break the chain of transmission is to improve the host resistance and immunity. Immunity is the acquired increased resistance on the part of the host to a specific infectious agent. Acquired immunity is the stimulus of the human immune system to develop resistance after the disease has infected the person or the person has had a vaccination against the disease. There are many communicable diseases for which vaccinations have been developed, which helps to prevent the diseases in populations. Please take a look at box 10-5 on page 158 of the textbook. There is a schedule of vaccinations that is given to specific populations. How many of these vaccinations have you had, and what if you decided to travel to another country? Would you seek out any of these vaccinations before you went? There are two types of acquired immunity in humans. The first type of acquired immunity is active immunity. This immunity occurs in response to an infection as the human body produces its own antibodies against the disease when the immune system is stimulated. This type of immunity can last for several years, such as with a tetanus vaccination, or by contracting the disease, such as chickenpox or mumps. Passive immunity is acquired either from your mom. As a baby is born, the mother transfers her immunity via the placenta, or from the transfer of already produced antibodies. Let's say an individual has been exposed to hepatitis A. If we can inject already produced antibodies into this person, we can potentially stimulate the immune system and prevent the virus from multiplying, since the antibodies will attack any developing viral agents. Passive immunity does not last as long as the humoral immunity, which is received from your natural methods, and passive immunity lasts only days to months. A new concept for you to understand is herd immunity. Herd immunity is the resistance of a population or group to the invasion and spread of an infectious agent. Populations have their own levels of immunity based on the level of resistance a population has to a communicable disease because of the high proportion of group members in the population who can't get the disease because they have been previously vaccinated or have previously had the disease themselves. An example of the herd immunity concept occurs with the polio vaccine. Early in the 1950s, the polio virus attacked individuals, especially children, causing them to lose their ability to move and breathe. Dr. Jonas Salk developed the polio vaccine and, using the concept of herd immunity, suggested that if just 85% of the population were immunized against polio, a polio epidemic would not occur. Thus began the requirement that all children would receive the polio vaccine. Those in my older generation received this vaccination in the form of an oral dose or IM injection. Now, all infants receive the OPV, or oral polio vaccine. Polio in the United States has been eradicated due to this increased herd immunity, as children and adults are no longer able to spread the disease because they have developed an immunity to it. In the clinical setting, human diseases are individualized health problems and are treated at the individual level. Infectious diseases are categorized as community health problems because of their potential to spread and cause community-wide and worldwide emergencies. Treating and eliminating diseases requires organized public efforts for their prevention and control. All states have laws addressing infectious disease control, such as which diseases must be reported and who has the authority to implement quarantines. All states have boards of health and departments of health to implement and enforce state health laws. At the national level, the CDC is the public health entity that is responsible for infectious disease control. The CDC has the responsibility for monitoring infectious diseases and supporting state and local governments in control of outbreaks or epidemics. Diseases are defined and classified according to their identified causes and cases. Once the disease is defined, disease occurrence can be compared across time, populations, and geographical areas, and appropriate control efforts can be implemented. This is the science of epidemiology you learned about in Week 1. The CDC has designated notifiable infectious diseases, meaning that healthcare providers who encounter these diseases must report them to their local or regional health department. A list of notifiable diseases is published by the CDC and can be found at their website, the National Notifiable Disease Surveillance System, which is listed in the textbook. As nurses, you should be aware of the practicing and reporting laws for these infectious diseases in Virginia or in any state where you practice. The CDC also publishes a very informative weekly report of notifiable diseases by region, state, and nation in Morbidity and Mortality Weekly Report. As you develop your community windshield survey for the practicum course, you should pay a visit to these sites to see if there are any specific reportable diseases in your own community. Information and recommendations on immunizations and vaccinations change regularly. The CDC recommends which immunizations to give, to whom they should be given, how they should be given, and how they should be transported, stored, and administered. If you have been involved in administering the influenza vaccination in the clinical setting, you know that you are required to provide a vaccination information statement that explains the benefits and risks to the vaccine recipients, their parents, or their legal representatives. Federal law requires that this information be given to recipients before they receive the vaccine. Legal documentation is important for future administration and follow-up of hypersensitivity reactions. Accurate records are needed to include the patient's name, the date that they were immunized, the type of vaccine, the vaccine manufacturer, the vaccine lot number, the date of the vaccination information statement, and the name and title of the person administering the vaccination. Whether you work in the clinical or community setting, you should be using primary, secondary, and tertiary prevention for infectious diseases for both individuals and the community as a whole. Table 10-3 on page 161 of the textbook provides a very good overview of how infectious diseases can be prevented at all of these prevention levels at either healthcare setting. Congratulations for getting through these 2 long videos. These 2 videos presented 2 different concepts, those related to disasters and those related to infectious diseases. Each of these concepts had multiple subtopics to consider. These subtopics were important because you needed to remember how that your role was going to be as a nurse in disaster planning and infectious disease prevention in the hospital setting and community setting. This awareness helps you enable to meet the first student learning outcome as you identify nursing standards of practice in the disaster planning and management, as well as prevention and management of the infectious diseases in both the clinical and community setting. These two videos also have important implications for any nurse in any healthcare setting because they can assist nurses in providing the most effective care in the event of a disaster as well as in the event of an infectious disease outbreak.